Greeting to the professor. Hi everyone. BU, I'm here to give my presentation on BU HGA 6904, that is evidence based practice in health services management. First of all, we are going with what is EBP. Evidence based practice is the integration of three main things, that is clinical expertise, patient value, and the most important one is the research evidence. All the process is in making decision making. Next, what is diabetes and how it is related to socioeconomic status? First of all, as we all know, diabetes is a very common disease which take place when the amount of a sugar is high in our blood. And the main reason behind the diabetes can be genetics, lack of healthy food, options of walkable spaces, mental illness. These are all the few factors. Moreover, with the increasing socioeconomic status, deaths related to diabetes increased dramatically. It's recorded in Australia around 2001 2003, 21,000 of the deaths, which is aged between 25 years. Now, next is what is the PICOT question in adults patient with diabetes? How does low socioeconomic status compared to high socioeconomic status result to high risk of complications? P is equal to adults, I is equal to diabetes, C is equal to high SES with low SES, O is equal to high risk of complications. Now, next is this is a summary table in which we are discussing about the two articles, and we are discussing about the author's publication purpose and conclusion of the two articles. Type 2 diabetes, and to test how smoking is linked with increasing complication of diseases in diabetes. Next, we are doing here two scales. That is, first one is the Jadad scale, and second one is the Pedro scale. And for the article one, we are using Jadad scale. The three main components, that is randomization, blinding, and an count of patient. First is the randomization. Yes, everything is taken randomly. There is no particular suggestions is being given to any other situations or citations. Everything is taken randomly. So scores are given to blinding no, an account of patient yes, the patients were known about it. So the three, it means the Jadad scale for the article one was not too good, not so bad. Next one is article 2 using Jadad scale, same here. Yes, randomization, no any random, everything was done randomly. Out of 2983, only 1899 and blinding was like this: the diabetes patient does not know about the services being processed, and an account of patient, half of the patient participated in both pre and the post assessment. So the marks are given 4.5 out of 5. It means that the Jadad scale is good for the article 2. Next is for the Pedro scale. Here for the article 1, there are the 10 main eligibilities we are taking for the Pedro scale. The eligibilities are criteria eligibility, random allocation, concealed allocation, baseline comparability, blind subject, blind therapies, blind assessors, adequate follow-up, intervention to treat analysis, between group comparison, post estimates, and variability. About of all these 10, only 5s were given. It means that Pedro scale for the article 1 was not too good, not too bad. It was an average. Next, the same for the Pedro scale, article 2. Out of 10, 7 marks were given. It means that for the Pedro scale, article 2 was too good, as this 7 points were given. Next are the conclusion. Both of the articles are going through the quality study. Each article has their own power and efficiency. Proof provided in these articles are based on real life. Some solid proof has been provided for the complications of diabetes, disease, decrease in socioeconomic status result in poor health. Useful to issue: high socioeconomic status can lead to reduced health complications of diabetes, less strength, increased quality of life, good and healthy diet, various other therapies to control diabetes. These are all about the various complications of diabetes. and about the picket question, and they are the references I have used with my presentation and with my research work. And thank you so much. If you have any questions, please ask, and thank you so much.